My guest is a former CDC public health advisor who was fired in May of 2025 by the Trump administration. She joins us on this episode to share her journey and how she is fighting back. You're listening to the PHEC podcast, episode 417. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My guest is a former CDC public health advisor who was fired in May by the Trump administration. She joins me on this episode to share her journey and how she's fighting back. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to the community partners, as well as the broader communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, which is drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links will also be provided in the show notes. I am excited to introduce you to my guest on this episode. Let me formally introduce her to you, and then I'll connect our conversation. Abby Tighe is a founding member of Fired But Fighting Back, a coalition of fired public health workers and their allies dedicated to advocating for public health and the public health workforce at the state, local, and federal levels. Abby is a former CDC public health advisor who was fired in May by the Trump administration. In her role at CDC, she worked as a project officer serving in the Drug-Free Communities branch, where she worked directly with local organizations to support youth substance use prevention. Abby is originally from the metro Atlanta area and currently resides there with her family. Abby joins us on this episode to share her journey. Let's connect my conversation with Abby right now. Hi, Abby. Welcome to the podcast. How are you?
I'm good. Thank you so much for having me. I'm so excited to be here.
I'm really happy that you're here. We're going to dive into some really serious updates. I'm excited to have you and share this platform with you. You have a very important message, and it's going to be a great conversation. I think my audience is going to be really leaning in. I'm hoping they will right now because I'm like putting all these little teasers out there. But this is an incredible opportunity. It's something more of a, I won't say like breaking like topic because we don't necessarily, it's not that type of a podcast. But in terms of, where we are here in the U.S., this is like mid-2025. We're recording this mid-July. So we're a good 6+ months into this new presidential administration that has had our public health systems, our country turned upside down. So Abby's going to be talking to us about how this has impacted her directly and how she's taken some of that into action. And I'd love for all of us listening to kind of lean in and listen for the opportunities where you can be supportive or where it may even resonate with you. But this is definitely a public health kind of right now conversation. And I anticipate we'll be having some updates, in the future because of the way that things are changing so quickly. So with all that teaser thrown in there, let's have you officially introduce yourself, Abby.
Yeah, of course. So my name is Abby Tighe. I'm a former CDC public health advisor. I was fired in February by the Trump administration, along with about 1,000 other people. I worked in the Division of Overdose Prevention in the Drug-Free Communities branch, and so worked directly with communities there. A few months after I was fired, about 2,000 folks, additional folks, were fired from CDC, and I think now we're right around a 3,000 mark just from CDC folk, just within the CDC, and HHS, the agency that hosts CDC, has far more folks that have been fired across different sub-agencies. So following my firing, me and a few other folks felt like we were lacking kind of information. There hasn't been a lot of great transparency from this administration so far. So we started a newsletter called Fired by Fighting to get information out to folks. And that newsletter has kind of turned into a grassroots coalition of people who are fighting for public health during what feels like the dismantling of our field. And so we are a collective of, former CDCers, public health people, state and local people, folks that are just really passionate about public health and want to get the information out there to the public in the United States about what cuts to CDC and what cuts to public health are going to mean for them. And then also we're doing a lot of work to advocate on behalf of the public, talking to our representatives, talking to policymakers about the important ways that CDC and HHS as a whole really impact our nation's health.
Yes. My heart breaks every time I relive the story. I think about it, and there can be all sorts of emotions rising up right now, thinking about what has happened and knowing that we still have a ways to go with this administration. So just acknowledging that. And I know that feeling, everyone could describe it differently, but we have a lot of feelings around this. I right away want to say I commend you, I applaud you for taking action and turning that into something we can do, kind of an attitude. It takes a lot of courage to do that. And we're going to dive more deeply into that. I want to kind of pause right there for a moment because I want to get to know a little bit more about you and your journey. And I love asking this question as I get to know guests on the podcast. And we're going to come back to kind of this, where you are and what you started. But if we could go back a bit in time, do you remember when you first learned about public health or when you first became interested in public health as a career?
Yeah. So first of all, thank you so much. Turning my energy into action has been the best thing for my mental health. And I know that's not everybody, but it's definitely the way to go for me. But yeah, my start into public health is probably pretty traditional to most folks. I didn't know what public health was. I actually went to school in Western North Carolina at WCU
I
because
love
I
that
wanted to
college,
work
by
in.
the way.
Oh, I love Western. It's so nice.
My son was in marching band in high school, and they did a
Oh,
band
yeah.
competition. We went to that university, my first trip there, and their marching band had the most, I love the performance. They had something called the Double Dutch Bus, which was like dating myself now, but they did this little performance on the field. Anyway, beautiful
Pride of the
setting.
mountain. Yeah,
Yes, it's absolutely beautiful there. So I'm sorry, I had to throw that in there.
that's
Please,
okay.
please continue.
Yeah, so I went to Western because they have a forensic anthropology program, and that's what I wanted to do originally. But at Western, you have to take a freshman seminar class, and the one I took was called From Black Death to Bioterrorism. And this was a public health class, and I took this one class and totally fell in love with public health. It was everything that I was looking for. I love science and history, and you get this really amazing combination of science, history, anthropology, sociology, all into public health. And it just absolutely spoke to me. I took that one class, changed my major, and then immediately went into global health disparities and head first into public health. I have a really deep passion for rural health because of my time at Western and because, I have family that lives in Appalachia, all up and down, the East Coast. And so really, seeing the both successes of public health for our poorest, most marginalized folks and how we can kind of scale these interventions to help everybody really spoke to my drive for community service. And it just was a perfect fit for me. And Western has kind of a safety-oriented, or it used to have a safety-oriented program, and so I did, industrial hygiene, all of kind of those things. But really, I did an internship at CDC in undergrad with the National Center for Environmental Health, and that is what put me on my path for an MPH. I did my MPH in Boston at Boston University, and while there, I did another internship with HRSA. And during that time, we had, the opioid crisis was going on, and so I got to do a lot of substance use related work and substance use prevention work in the New England area, really at the height of, need. And that kind of, sparked this next level of interest for me, which was, working with folks who were struggling with, substance use, and really looking at kind of the changes that we were seeing in usage from like single usage of like one substance to this kind of polysubstance use, which I think we are really finding ourselves in now. But I feel like that's a whole separate conversation you could have.
Oh, it's really fascinating. I love that story and really being able to follow just because you're in my region, you're located in some of my favorite places, and also mentioning like that rural health, really important. And when you're thinking about like a mountain community, that's even a slightly different kind of a rural health community, and a very fascinating story, this global perspective. And so you completed your MPH in Boston?
Yep, at Boston University.
Okay. And then how did you end up at CDC? I guess, did you write straight from Boston there? I know the internship opened that door, but did you go straight there, or did you work anywhere else before then?
No, I actually worked in the private sector for 2 years. I worked at a PR firm in New York City, but my contract I worked on was for CDC. PR was not my passion, but I learned so much in that job about how to speak to media, the messaging of public health, and like bridging kind of that really like scientific, public health nerd talk into things that your everyday people are going to understand and appreciate and like want to know more about. So I really learned some valuable skills in kind of that PR role. From there, I went to Emory, where I ran comms for another CDC grant. During that time, both while in PR and at Emory, I worked in NCHHSTP, which is HIV, hepatitis, STDs, a little bit of adolescent health. And so kind of this like broad infectious disease area. But substance use prevention is kind of my passion, like a lot of people in the US, my family, my friends, like we've all been impacted by what we've seen happen with the rise of opioid crisis and now the use of methamphetamine and alcohol use. And so I think I have a personal passion for that, especially with my roots to kind of the Appalachian area.
Yeah. Yeah. Though thank you for filling in that little gap there. And what I want to also kind of add to a little bit is you made a really good point about that, that PR job that you think, well, it's not my passion, but it's such an important step. And the reason I want to spend some time here is because I think people will discredit those other jobs and opportunities to work where it doesn't look like traditional public health, and they're struggling to figure out like, how does this fit in? But yet you just gave a perfect example of how the skills obtained elsewhere are very complementary and kind of create what I call a superpower, these, kind of non-traditional intersections where you can bring that together to amplify the work in public health. So that I just wanted to point that out because I often think people listen to this podcast get sick of hearing me say this all the time. But, it's an important thing to point out because I think no matter where you work, you can find a connection to public health or something you bring from that to bring, into public health.
Absolutely. I've called it building my public health toolbox, and like you can't get everything from one place. You have to kind of move around. And that's definitely kind of been my experience, that taking the chance and doing something that might not perfectly align. Usually, if you're passionate about something, you can connect the dots.
Yeah. Yeah. Well, thank you for that bit of kind of backstory and getting to know you and your journey. When I first heard of the coalition and what you're doing, you gave your presentation was like we did these kind of TED Talk styles at Policy Action Institute, which was held in Washington, D.C. And we had a group that you each had a few minutes to give your presentation. And then we sat down and I kind of moderated a Q&A session. And it was a lot of engagement from the audience and during that time. You don't have to repeat your whole TED Talk, but could you kind of maybe summarize that a little bit and kind of fill in some of the gaps of what you've already introduced in terms of what you're doing?
Yeah, of course. So I think my main message from my TED Talk is that me and my colleagues at Fire But Fighting, we're learning a lot of things about public health and engagement during this time. And so some of those key things that we are really noticing is that we kind of have to go back to zero when we speak to the public, when we speak to the media. Like, we really have to do the work to explain what public health is, why it impacts people, and how, especially when we're talking to journalists, how money from, federal government moves through CDC and then even like trickling down into all of your communities that you see across this country. I mean, nobody is untouched by CDC, and we're really trying to get that message across. And it's required us to kind of really scale back the way that we speak to people so that we aren't getting too lost in the weeds, but that we're communicating what we actually need. And I think when I spoke about this at the Policy Action Institute, I mentioned like in public health, we've been talking about plain language campaigns forever. And our health communicators, they've been yelling at us the most about it. And the scientists and people within public health are like, yeah, we brush them off. But they're right. We need to do this. And I think what we've learned is that plain language is important both in our public health campaigns that we use to get people vaccinated for the flu or to, encourage them to wear their helmet when they ride a bike. But plain language is also really important in how we talk about public health generally and about the overarching importance of it. Using the phrase substance use prevention probably isn't the right way to communicate with people who in their communities are struggling with substance use. And so really thinking about how we can talk about kind of these broader topics and about public health and prevention as a whole in a way that is plain and understandable to the general public. So that's one of the lessons. The other really important lesson that we've learned is we've been talking to a lot of congressional staffers to help inform, senators, House representatives. And we're finding that, like, on a government level, people don't understand public health. They don't understand what CDC does. They understand Medicaid, they understand the legislative process, but they can't really tell you what CDC does. Like, this money that we appropriate to the Office on Smoking Health, they know that that money goes there, but they don't know what that looks like in their own communities, which is, I think, a tragedy because they're doing the work to pass the money, and it's something that we should be celebrating and talking about. And so I think that this disconnect, particularly among policymakers, is part of why we've had a really hard time standing up for public health in this moment of time. And so we're thinking a lot about how we can better educate policymakers on the importance of public health, the importance of these programs, both so that they can advocate for them and so that they can communicate about what they're doing and why these are important to their own constituents. And this, hasn't really taken shape yet for us, but we're talking about what that might look like. And we're talking about encouraging your senators or congresspeople to hire staff that have worked in government or have worked in your local public health department or have applied for grants and who kind of have more of that technical knowledge outside of just like Medicaid and insurance and healthcare. Because like we in public health know that you have public health and you have medicine and they intersect, but they are not the same. And I think that kind of, there's a disconnect about that at the policymaker level, at least in Washington. The other thing we're talking about is we want to give the public a way to like look at a senator and say, this person supports public health. And so we're talking about maybe a public health report card or like different ways that we can make sure people know what policies are supported by their representatives. And then my last point, which can be a hot take, and that's that we have talked a long time about how public health is not political, but we are at a point in time where we have to do the work to depoliticize public health because it is political now. I don't think that we made it political as far as like public health professionals go, but I think that in the aftermath of COVID, public health, as a field has become this space of political argument. And I think it is our job as the public health professionals to depoliticize that. To save public health, we're going to need a really big tent. And so that means that we have to do a really good job about communicating to people, who might not vote for public health, you know, initiatives right now. And I think the way that we do that is that we show people that we all want the same outcomes. We want less women to die in childbirth. We want kids to grow old and be successful human beings. We want people who are sick to be able to go to the hospital and get the care that they need. And we want to prevent people from getting sick in the beginning because we want people to live long, healthy, prosperous lives. So at its core, we all want the same thing. I mean, maybe not all, but most of us do. And I think that core message is getting lost in our kind of talk about prevention. And so going back to that basic, like, we want this outcome for you, for your family, for your community, and using that framing when we talk to folks who may, think that it's good that we're firing people from HHS so that they can, understand that we are not the enemy. We are regular people who have a passion and that we care about this community. We care about this country. We are just as American as anybody else. And we care deeply about like the health and safety of the people who live here.
Yeah. When I heard you share this, you were doing your TED Talk. I was actually sitting behind you, kind of, waiting for, as each of you spoke, you took your spot on the stage. And it was all I could do. I was like nodding with everything inside, like, oh my gosh. I'm one of those people who has been saying it for years and years, like, we're not communicating, the value. We're speaking a different language, and this is not translating. And I've said it a lot on this podcast for years. It's one of the reasons why even in my consulting, I'm adamant about communicating, your health and information in plain language. It's cool to say I'm an epidemiologist, but most people don't even know what that is. And if I lead with that outside of my public health circle, then I'm working backwards from that.
Yeah.
So, and sometimes even when I think the language is plain and clear, I have to test it out and read the room and understand that a lot of times it's still landing backwards. I love the theme that kept emerging about stories, and relatable stories and real stories. And regardless of what, happened before, what we weren't doing or what I was saying before, like, we're here now. And another reason I really wanted to bring you on this podcast was because, we're still so very aligned. So whatever got us to this point, we're here. And this, you said, was it 5 points? So the 5 lessons that you pulled out there,
Mm-hmm.
I really want to see and support like this forward progress because, we do need to value, communicate it so that I wholeheartedly agree with you. If our policymakers don't understand public health, how are they going to advocate for us? How are they going to speak it? How are they going to explain it? How are they going to value it? And, no one's sitting around talking about how they're going to stop funding physicians, primary care. They get that value. So they need to understand the public health value and understand that we do what we do. And like you said, these people who are thinking, they're celebrating the firing of all these employees, that we understand the value in public health. We're just like shocked and don't know what to say. But for others who don't understand the value, they don't see it the way that we do. They don't get it. So we're on the same page. So now what's next?
Oh, a big loaded question. Yeah. So I think right now, what's next is we are really trying to build up our coalition. We've applied for our nonprofit status. We're hoping to, fill some of these gaps in transparency that you're seeing from the current administration, provide, resources and information that is accurate and correct and that kind of pushes against some of the narratives that we're seeing coming out of HHS. Particularly, we're seeing a lot of really harmful messaging around vaccines. And so we're trying to think about how we can push out campaigns and elevate the voices of people who are true experts in these fields to make sure people have access to accurate information. And then doing the work to get into spots where we can get that information out there, whether that's, policymakers, podcasts, just kind of, and social media especially. People get their health information from social media now, which I don't know if that's good or bad, but we are present there and trying to use our own platform to get correct information out. And in long term, so we have a group of CDC alum that we work really closely with that are just like fangirl over these incredible public health people. And so we've talked to them a lot. And one thing that they have talked to us about is that we are kind of in a way trying to relay a foundation for how we will rebuild public health in the coming future. We don't really know what that looks like right now. I think we're still kind of early in the dismantling period, but they see this work as a way to establish trust and really lay out what like a successful, equitable public health program would look like at the federal level. And so that's something we are talking about, kind of long term with folks who have far more experience than I do. I think that we are all kind of grieving the fact that the public health that we knew probably will not exist long term, but that doesn't mean that it will not exist. We're trying to view it as an opportunity to kind of make it better, make our initiatives better, make our messaging better. And so I think a lot of like strategic planning is going on right now and long-term thinking. Yeah, I think that's kind of where we're at.
So listening to you, this question's kind of popping in my mind as far as you're aware of. Is there any other group that is taking this kind of forward action the way that this coalition is intending? In other words, this proactive step to kind of rebuild public health in these systems? Because where we normally would go to for this kind of information, most of these places are being broken down. So are you aware of any other initiative or group where they are trying to do what you're doing with the coalition?
I think right now there are a lot of groups that are trying to assess the damage, which we're definitely doing as well. But I think that the forward-looking piece is really hard for folks. And it's something that we are talking about, but not really there yet, because we're working with a lot of people who like expected their whole career to be at CDC and it's been cut short. And, that's a hard thing to grieve. It can take months and years to get past that. And so I think that right now, I don't know of any other groups that are kind of in this rebuilding phase. Internally, there are a lot of like agency groups. So folks who have been fired from NIH and EPA and USAID that have similar kind of coalition networks. And, where we talk to them, we kind of try to collaborate with them. But I mean, I'm optimistic that a lot of us, maybe early career folks who have been pushed out and are angry and are motivated and hungry to like do this work are going to be able to kind of help drive this like progress forward, even while we are being, silenced and targeted by this administration.
Yeah. And that's really kind of where I was going to. So there are, and I guess like multiple coalitions and people just, have their own little groups, right? My hope would be for there to be this collaborative effort, because we're definitely stronger together. That's like with anything. But right now, with what we're experiencing, partnering, locking arms with folks, our colleagues, is more important than it's ever been. And I think we heard a lot of that in the conversations at PAI where we had, policymakers talking about how, if you remember, it was really important to me to have these kind of questions in there, like let the audience know what you need from us. So when the panel of like the state legislators are there, one of the questions is how can the audience members help you support public health in the conversations with your colleagues? So I think it's important that we come together. And they all said, they would tell us, different ways, share your stories. We need to tell these stories, right? So with all of the coalitions and groups and folks that are coming together, even if they're in smaller pockets, I think it's important to make sure that, and I'm not telling you anything you don't know, but I just don't want to see the work divided and everyone's trying to do their own thing. I think it's like really going to be important to come together and collectively pool the resources and the energy and be able to do, what needs to be done, which is one of the reasons I wanted you on this podcast to talk about what you're doing to the listeners of this podcast who, like I said at the very beginning of this conversation, it may resonate with them. They may be there alone. Maybe they got fired and they're dealing with all of this and didn't even know that this was an option or this was a thing. This is an opportunity to start to come together. Maybe people who weren't impacted directly, they didn't lose their job, but they want to do something to help and support. I asked you this ahead of time, but this is a time where I want to know, like, if someone is listening and they want to be able to help support you, how could they do that? Like what could, yeah.
Yeah, absolutely. So there are a lot of ways to get involved. Firebird Fighting is not just for fired people or federal workers. It is a coalition that aims to advocate for public health infrastructure at the federal, state, local level. So if you are interested in making sure that we have public health infrastructure in this country, this is like the perfect opportunity for you to volunteer, to engage with us on social media, to sign up for our newsletter, and long term, help us get this messaging to your representatives and using our materials to inform, how you're going to vote in the future and what kind of candidates you support and making sure that they align with kind of the public health needs that we have in this country. And I want to point out that, like, I would argue that everything is public health. And so when we talk about kind of these cross collaborative efforts with NIH and, EPA and whatever, we are moving to a model where we are inclusive of all public health, not just CDC, not just NIH, not just your kind of traditional epidemiology approaches, but like if you work in EPA and you know how the environment impacts, individuals' health, that is public health. If you work for NASA and you are sending people into space, understanding the impacts of that, both in waste that comes off of, the emissions of a rocket and the impacts of sending someone to space physically, like those are public health. And so we're trying to find ways that we can intersect better and have this kind of overarching view of public health, which I think is great. And I'm excited to like be a part of because I, have this strong opinion that everything is public health, everything can be connected to public health. And so those are really, we're really open to everybody who's like into this cause. We want to make sure that people feel welcome and can participate. And then an easy way that is not related to us, but something that you can do is folks have been putting out letters to their agency. So NIH released a letter to their director talking about all of the kind of transparency issues and ways that the public are being hurt by this administration. EPA did the same thing. And today NASA released a letter as well. You can sign on to all of these letters through Stand Up for Science. And I will say that our friends at EPA have been retaliated against. They have been put on administrative leave as a result of them signing these letters. And so standing up for these folks and standing up for, their First Amendment rights and their, efforts to protect the American people at the risk of them losing their jobs, I think is something we should really be sounding the alarm about and signing those letters and calling our Congress people to make sure that they're supported. Because if people don't feel like they can tell the truth within government, we are sliding down a really bad slide into, I don't even know what this would look like long term.
Right, right. I definitely agree with you. Well, we will have links to connect with you on the show notes page for this episode so that people know how to reach out and continue this conversation and go further with you. I know that, at the time of this recording, like I said, kind of late July, it will actually release a little bit after that. So, and someone may be listening to this in beginning of 2026. So
yeah,
in that time frame, you probably will have even more things formed with the coalition. And I think the key is to just reach out. I would encourage you to connect and just say, hey, Abby, I heard you on Dr. Huntley's podcast. What can we do? Where are you now? But for someone listening now, what would be the best way for them to connect with you?
Yeah, so we have a website, firedbutfighting.org, and on that website, you can find everything, including a volunteer submission form if you're interested in volunteering with us and learning more about how you can kind of pitch in and help out with our work. You can also go to cdcdataproject.org, which is a really cool dashboard that our data team has put together where you can see the impacts of public health cuts to your own states and communities based on program, and you can use that information to speak to your Congress folks and speak to your local policymakers about why they should be prioritizing your public health.
Oh, that sounds interesting. What's that URL again?
cdcdataproject.org.
Okay, we'll make sure we get that in the show notes for sure. Wow, Abby, thank you so much for taking time and coming onto this podcast and, just sharing about your journey, but also about this important work that you're doing and how you are, you've turned this into something, we can say you're making lemonade. You turn this lemon into lemonade. And I just appreciate what you're doing and appreciate you.
Awesome. Thank you so much for having me. I really appreciate the opportunity to talk about this. And I want to note that this is a collective effort. I'm not in charge of anything. We are all just doing the best we can. And so my colleagues have been amazing in getting this up and running and, are great partners to have.
Wonderful. Well, we will definitely be in touch.
Awesome. Thank you so much.
I really hope you enjoyed that conversation as much as we did. I look forward to following Abby's journey and having her back on the podcast again in the future for updates. I do encourage you to connect with her and learn more about the work that she's doing and how you might be able to support the mission as well. When you reach out to Abby, make sure that you let her know that you heard her on this podcast episode. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 417, can be found at phecpodcast.com. Once you're there, just navigate to episode 417 to find its show notes. One more thing before we go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals from around the world. You can download our new PHEC podcast community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.